Before we get started, I just want to acknowledge that the University of Alberta is located on Treaty 6 territory and respects the histories, languages, and cultures of First Nations, Métis, Inuit, and all First Peoples of Canada, whose presence continues to enrich our vibrant community. Next, I want to just cover what a dentist and a dental hygienist does. They're both members of the dental care team and they collaborate together to provide patients with comprehensive oral care. So, a dentist diagnoses oral health issues. They develop the treatment plans when they determine what the issue is. They also perform a variety of procedures such as fillings, extractions, implants. They also interpret dental x-rays, so looking for those cavities and things like that. And they provide general guidance about oral health. For the dental hygienist, they perform teeth scaling and cleanings. They also take dental x-rays and they can apply the fluoride treatment. They also educate patients about oral health care. So before I get into all the nitty-gritty, if there is anything that you think about later after this session that you want to ask, you can always reach us at this email address and you can always call us as well. So this application timeline applies to both programs. So this will give you a little bit of an idea on when to apply and what's being collected at different points. So our applications are always open in the year prior to the fall term that you're seeking admission for. So for fall 2026 applications, those are going to be opening this July 1st, 2025. And then you can see here that I've also highlighted when the fall term is and when the winter term is. That's because the coming academic year is considered as part of the application since it takes so long for us to go through our entire process. So we'll be looking at the 2025-2026 academic year if you were applying for fall 2026. So during that time, we're collecting transcripts to get the grades from that current year. So like I said, they open July 1st. They close on November 1st. So keep that date in mind, super important. We don't take late applications. But then we just need by November 15th a transcript that shows all your course registration and any courses that you've completed in the past. And then after that, by February 1st, we need a transcript that shows your fall grades. So winter term's over, or sorry, fall term is over. You're in the winter term. That's when we'll get those fall grades, which we will use towards GPA calculations to determine interview selection. And those interviews are held in early March. And then we just need a final transcript by June 15th. That has both your fall and winter grades in there, and then we'll do offers of admission between May to July. So first off, I'm going to get into the Doctor of Dental Surgery program, and then after that, I will do the Dental Hygiene program. So the Doctor of Dental Surgery, or DDS program, is a 4-year professional program. Applicants to this program need to complete at least 2 years of university level study before they can seek admission. And therefore, it takes a minimum amount of 6 years to complete a Doctor of Dental Surgery degree. So I'll cover a little bit about the curriculum. So the very first 2 years of the curriculum are a lot of lectures and laboratory work. So that includes the didactic lectures and our simulation laboratories. So you can see in this image here that we have students practicing on mannequins so that they learn proper posture, how to hold their tools, start working on things before they start working on our real patients. You also do spend a decent amount of time within the first few weeks doing co-learning with our upper year students. So you're not going to be practicing on people yourself, but you will be there assisting an upper year student and kind of learning from them while you're in your first 2 years. In your last 2 years, you're basically going to be almost 100% in our oral health clinic, which is located in the K Edmonton Clinic, which is just south of ECA. You're also going to do external rotations as well. So you're not just doing practice in our clinic, which is a fully functional clinic. It has all the specialties, it has great facilities for that, but you'll also do these external rotations. So you can do stuff at the U of A hospital, the Glen Rose Rehabilitation Hospital, and then we also have two satellite clinics in Northern Alberta where we send you off, and they're basically like small private clinics in rural areas. So just a quick overview of what the different requirements are for the DDS program. It includes academics, the Canadian Dental Aptitude Test, a situational judgment test, and personal experiences. If you're wanting to find way more information than I can cover here today, you can go to our website here. This will take you directly to the DDS website. A note for certain people, we do require English language proficiency and spoken English proficiency. That may or may not apply to you. You can find more information on our website as well. So first I'll get into what the minimum academic requirements are. So like I mentioned, you had to do 2 years of university level study. This is done in any program of your choosing. A lot of people do choose the Faculty of Science. However, it's really up to you what you would like to do as long as you're able to meet our requirements within that program. So 60 units of transferable coursework is what's needed. But two of those fall winter years have to have 30 units in each year. So that course load requirement doesn't include spring and summer terms. And this can be, like I kind of said before, completed or in progress at the time. So as for required courses, we have a list of them here. So it hits things like chemistry, biology, English and stats. Anything that says 6 units next to it is either two courses or a year-long course. At the U of A, you'll typically see two courses for English, but we offer human physiology, which is a year-long course. So that's what that would mean. If you're attending at the U of A, we only require a minimum grade of a D, which is a pass. If you're transferring from another institution to the U of A, a minimum grade for a transfer course is a C minus. If you want to know what you should be taking at the U of A, we list those right on our website, but we also do have other guides for common institutions we see, like McEwen and whatnot. And we also have a list of transfer search tools the U of A has if we don't have your institution specifically listed or you're wanting to check for other courses. Last thing about academics is that there is a minimum overall GPA of a 3.3. That's been lowered since 2 years ago, which was a 3.5. It's not used competitively anymore. I like to make sure that I share that because a lot of people are unaware of it. So all you have to have is a 3.3, and then we're considering other things for interview selection and whatnot. How we calculate our overall GPA is using all full-time coursework. So it's not just the last 2 years, it's all full-time coursework. What's full-time? Well, the minimum would be for fall winter years, 18 units, and spring summer would be 12 units. So if you ever take one course in the summer just because, that course won't be included if it's not accompanied by 3 other courses. Another thing we do when calculating GPA is that if you've done 4 or more years of full-time coursework, we'll drop the lowest GPA year, as long as it's not the most recent year that you've completed or one of only two 30-unit years. So moving on to some of the other requirements that we have in our program. So one is the Canadian Dental Aptitude Test. The deadline for this is January 15th. So we usually recommend trying to aim no later than end of November to take it, just so then you have ample time to make sure the scores get to us. Another point is that you have to have a minimum score of 15 in each of the following sections: Survey of Natural Sciences, Perceptual Ability, and the Reading Comprehension Test. So what we typically recommend is that when you're thinking about first applying, attempt it early in the year. So then you get your scores back. And if you're either below the minimums or you're just not satisfied with the score that you're getting, you could attempt it again later because you have 60 days between attempts. So that'll allow you to study up and try the test again later in the year. Because if you wait till the very last minute to take the test and things don't go the way you want to, there's no other opportunity to take it again that year before we need the scores. You can take it up to 3 times per year. So if you really want to go for it, you could do even more. But just so you know, the test can't be any older than 5 years on November 1st. So that's quite a long time. If you do the DAT, it'll likely last for as long as you'd ever want to attempt to apply to our program. If you do take it more than once, we use your best set of scores. So we don't cherry pick scores from different tests. It's just what test has the best set of scores. You just send all your scores to us and we'll select the best from there. If you want more information about how to go into booking the test, what's covered, all of that stuff, it's at the CDA website. So just to give you an idea of scores to aim for, this is the averages and minimums of the 2024 admitted DDS applicants. So you can see that the minimum range is 17 to 18, with some people getting perfect scores, and our average there is somewhere between a 22 to 23. So that's kind of what the competitive DAT is looking like. Next, we have our situational judgment test. For the doctor dental surgery. That's the CSP 10211 Casper 2. They've changed the name slightly. Just make sure, and I'll mention this when we get to dental hygiene, they're different tests for different programs, so make sure you take the right one. If you're applying to both, take both. But the Casper site's pretty good about when you're going to select when the offerings are. It'll usually be pretty good about making sure you take the right test there. So what's the Casper test? It's an online assessment that does looks at your non-cognitive skills, interpersonal characteristics, personal values, priorities, all these things that are believed to be important to be a dentist. Deadline for that's January 2nd, and they usually offer them between July to December. These can only be used for the current application cycle. So if you have to apply year after year, you have to do the test year after year. If you want to learn more about that, it's offered by Acuity Insights. Lastly, we got our personal experiences. This is a form that'll become available after you submit your application. The deadline for that is November 1st. So if you recall, the deadline for application is also November 1st. So we recommend applying a few days in advance so then you get the forms and you can fill them out. There's a few different sections, including employment, leadership and volunteer, life experiences and achievements, and personal highlights. For the first two, you do need to provide contact information for a verifier so they can confirm that the information you provided is accurate. So we go through all of that. Then we have our interview and personal statement. We sent out these invitations in mid-February, and the selection is based on your DAT score, Casper score, and the personal experiences score. Like I said, GPA is not a factor. You just need to meet basically will meet or do meet the academic requirements, and then that's when the selection will come for ranking. With that, we do a multiple mini interview. It's being done online. There are stations that take 10 minutes to go through. You're given a question or scenario that you prepare for, and then you have 8 minutes to answer or respond. For the personal statement, this is booked in on the same day as your interview, and you get a set amount of time to complete a written response to a question that you're provided at that time. Uh, and so then from there, we have our final selection. So for the DDS program, we have 32 seats total. Up to 3 of those seats are available for non-Alberta residents, and we don't have a limitation on the number of seats for qualified Indigenous applicants. For our selection criteria, basically it's pretty much everything. So the DAT, Casper, personal experiences, and then add your interview score and personal statement. Those offers are sent somewhere between May to July. So to give you an idea of how many applicants we see to our DDS program, last year we had 262 qualified applicants and we took 32 of them. And you can also see the split between our Alberta residents and our non-Alberta residents. All right, so we'll move straight into the Bachelor of Science in Dental Hygiene program. This one is a 3-year program where applicants have to complete 1 year of study in advance. So that means the total time to finish this degree is a minimum of 4 years. So for our curriculum, very much similar. The first two-ish years are didactic lectures, simulation lab, and then later on you spend more and more time in the oral health clinic. And then you also do similar types of external rotations at the U of A hospital and whatnot. Similar requirements, except you don't have to do the dental aptitude test. If you want to learn even more about this program, you can find all kinds of stuff at this web address. So for the minimum academic requirements, you have to do the 30 units of transferable coursework. That's the 1 year. Again, any program, don't have to finish your degree. And then the course load requirement for this program is one fall winter with 27 units. If you're wanting to apply in your very first year, I would recommend doing all 30 units in the fall winter, even though you only have to do 27. And the reason for that is that the spring term in the year that you apply, we need that transcript by June 15th. A lot of spring courses finish right around that date, and if we don't get the grade by the deadline, um, it won't end up counting and the application will get thrown out. So if you want to be safe rather than sorry, um, I would just do all 30 units in the first year. If you're kind of further along in your degree and you haven't done 27 units yet, then just do the 27 units and that's fine. So for required courses, there's a lot of similarities. The main change would be that you do a sociology and psychology class, and then also you have two options in any faculty, and it really means in any faculty. Do whatever you like as long as it transfers to the U of A. We also have transfer tools specifically for institutions we see for dental hygiene as well, so definitely take a look at our website. For this one, the minimum overall GPA is a 2.7. However, it is used competitively in the program. As you can kind of see here underneath, our admitted class for 2024 had quite a bit of a range, with the average being a 3.59. Obviously, you don't have to hit that to guarantee, to get admission. I'd say a 3 or higher is definitely more competitive, but the higher the better. So we have a situational judgment test for this one. It has a much longer name. I don't know, they may be changing it in the future because they've changed the other one, but you'll be able to always find the correct test at Acuity Insights. This one, they've started to offer more opportunities to take it, so definitely take a look at their website. They usually will post when they have dates, kind of early summer. So that's when you can know when you can take it. Personal experiences, very similar. Just make sure you apply early so you have the chance to get that form. For the interview, there's no personal statement for this one, but the selection is going to be based on your overall GPA and the Casper test results. And those invitations are also sent out in mid-February. For our final selection, we have 46 seats total for this program, with up to 4 seats for non-Alberta, no limitation on those Indigenous applicants, and the selection criteria, in addition to the GPA and Casper, also includes the personal experiences and interview score, with offers being sent from May to July. To give you an idea of how many qualified applicants we have for this program, we had 126 last year and took the 46. I'll do a little plug for Pathways to Dentistry. This is an organization run by students within our programs. The whole goal of this group is to increase access to the programs by doing a variety of activities. So some of the really great things that they do is they have Facebook and an email address that you can reach out to them. So you can definitely reach out to me for anything related to admissions, how do you get in, things like that. But if you're like, what's it like? How hard is it? What things did you do for volunteer activities? Things like that. They would be able to give you answers on what things that they were doing. They also do an information session, kind of like this one. But the coolest thing that I think they do is they do an annual workshop where they actually book our simulation lab and you can come and visit there, and then you can actually try your hand skills out. And I think that's really cool. Otherwise, I am ready to answer some questions.
That was a great presentation about our two different programs. Any questions, pop them in the Q&A. We did have one about like if this meeting's going to be recorded. It is recorded, and we will most likely be posting it on our on-demand webpage in the future. It won't be done right away. This is the last of our offerings for our Program Pathways event, and we've had about seven in total, I think, 6 or 7 sessions. So it's a lot of videos to edit and get up on our website. So please give us a little bit of time to get those up there. What is the GPA scale out of is the first question.
Yeah, so the U of A uses a 4-point scale. So if you're at an institution that also uses a 4-point scale, that would be basically the same grade of whatever you're receiving there. You can dig around somewhere on the U of A website and find what our grading scale is, like what a B is equivalent to on a 4-point scale. If you check that and compare it to your current scale at your institution, if they're the same, then you don't really have to worry about it. It's just the same at both. If it's something different, then it can be a little more challenging. If you want to reach out to us about that, we can help.
This is a good one. If you apply for both dental hygiene and dentistry, will it be a problem with interviews being on the same day?
That's a really good question. So if you apply to both programs, you would only need to do one interview. So we'll book you in for one interview and use your score for both. So then you're not having to do it twice.
That's a great question. Yeah. Um, okay. Are there internship opportunities to study and gain experience in dentistry? Maybe if you're interested in dentistry but not in the program yet, or while you're in the program.
So we don't offer anything to students, so there's no like observerships or things like that. We kind of have to be in our program to get those. So I'm not familiar with any kind of opportunities within our school to do that. Um, Usually people that are wanting to learn more about dentistry will often shadow. So they'll find a dentist, or if you most people have a dentist, if you just ask them if they would be interested or let you come and see their clinic. Sometimes they're willing to show you around and see things. Internship wise, we do like have lots of practicums and external stuff. So some of those are things you can opt into or ask about. So those will give you different experiences. The only other thing I could add is that once you do graduate, we offer I only remember the acronym. It's called GPR. I think it's a general practice residency. So basically, it's just an extra year. We have a location in Calgary as well as Edmonton. But basically, you just work kind of in our clinic and such, and just get a little bit more experience than you would just another year of clinical experience, basically. They don't take too many people in that, but that's a way to gain even more experience before going out into the field or looking at specialties and things.
Okay. Quick question that I will answer here. A lot of students are asking about courses to take in high school. The courses you take in high school are going to matter on what program you enter for your undergraduate degree. So that's all going to depend on what you're applying to for that. But in terms of taking the prerequisites for dentistry and dental hygiene, taking things like Bio 30 and Chem 30 at the grade 12 level are definitely going to be required. And then Math 30-1 for sure, and English 30-1 for sure.
Mhm.
Um, do you know, Rosanna, what the average dentist and dental hygienist make currently?
Not off the top of my head, but a great place to look is ALIS. That's through the government. It's ALIS. They survey dentists, dental hygienists, places that offer those kinds of jobs, and get information on what are the salaries at. And they're pretty good too, because they don't just say like, oh, this you could make like the top amount. It kind of gives you an idea of like what's a low end, what's average, what's entry versus being very experienced. So you can find that information there.
And then question on the Casper test, if you know, is there a minimum grade on the Casper test? How are people scored?
So there's no minimum grade. You can find a lot more information on the Casper website, but generally, what they're doing is so how they score it is, um, based on basically more or less a curve. It's a quartile system. So you're being compared to everyone else that took the test that year, which is why you have to take it every year because it's about the pool of applicants that applied. So when you get your score back, it'll say you're in this quartile. So um, that will let you know kind of are you the bottom fourth in the top, top two kind of thing. Um, so that's what you'll get. We get slightly more detailed information than quartile, but we use that basically to know where you are measuring up against your peers.
Um, Good question here on how would shadowing hours factor into an application, or would you look at that as part of an application?
So we don't require shadowing hours. If you do that, the place I would typically say you would include it would be in the life experiences and achievements section. That one's really broad. It allows for hobbies and other things you do. And if you want to mention your shadowing hours there and what that's done for you, definitely go ahead. Some people ask if it can be put into the volunteer section. The only thing that I say about how to differentiate whether it belongs in volunteer or not is whether or not you're offering anything, basically labor to them for in exchange for the shadowing. So if you're just there and observing, like you basically are just hanging out, then that's more of a thing just for you. You're asking something from them. Whereas if they were like, okay, yes, you can shadow and you can watch us, but also can you collect the instruments and go take them here, or sweep the floor, or greet people when they come in, or fill the water cooler or something like that. Then you're doing something to assist them in exchange for free. So that would kind of be my differentiation between that and how you would include it.
Perfect. Another for personal statements for the DDS program. Are they timed? Are they similar to an interview, or are they just in a written format?
hmm so the personal statements are timed. So you'll be told when you get your invite to interview, it'll say this is the time that your personal statement is going to start. And then you only have a set amount of time to write a written response. So um, it's somewhat like the interview, but basically we're going to provide a prompt at that time that's a question and say basically answer this. And then you just have time to write a short. It's not very like it's about a page or so response. Like we're not expecting a 5-page essay. That would be a lot of essays to read. So we're expecting kind of a page-long response to that.
And alongside that, is there a minimum score on the personal response, and how is that analyzed for their application?
So we don't have a minimum score for personal statements. So we have a rubric that we will score you against, and then that's used as part of the selection for admission.
And then in terms of the DDS program, does the U of A prefer to take students who did their undergrad at the U of A over ones that did
Mhm.
their undergrad or requirements at another institution?
That's a great question. So we don't have a preference for any particular institution, for U of A or otherwise. We just are looking to see whether you meet the requirements of the program, and just calculating your GPA from there. When we meet with the admissions committee and we provide, here is our selection of candidates, we don't provide them any personal information about you so that people aren't making any kind of bias. Decisions in that way. So it's not something that's even a factor at all that anyone could be picking U of A students over others for any reason.
Um, are there any ways to prepare for the MMI?
That's a great question. Definitely definitely practicing, talking with other people. There's lots of MMI practice questions online that you can find. Just getting used to that thinking on your feet is really the best thing you can do. It's like a job interview in a way, right? If you don't really think about it or prepare anything, um, then you'll get there and feel really flustered because you're just like, I don't know what to even say. But those kinds of things get you thinking, the juice is flowing and starting to think in that kind of mindset.
So I have a question here in terms of application timeline. I would think this would be for the dental hygiene program. So they're saying so they would need to be out of the U of A for a year and then apply, or would they be able to apply for the program at the same time when they're first applying to get into the U of A?
Um, I think I understand the question. So, yeah, for dental hygiene, because you only have to do 1 year of study beforehand, you'll likely be applying kind of early March, right? If not earlier, to what right out of high school, right? You're going out of high school, heading into your post-secondary program, and you get great news in the summer, right? You find out that you've been admitted to the U of A or wherever you're going. You can apply that summer to the dental hygiene program. You won't have anything done at that point, but you should be registered in all your courses by the time, November kind of rolls around, for sure, because you September passed. But you should know what you're registered in at that point. And so we'll be looking to make sure you're planning to take all the courses necessary. And then you'll be done that year by the time we would be thinking of offering admission.
This is a good one. Are there any specialization programs in dentistry, or is it just one general program?
We have a few specialty programs. I know there's sometimes more at other institutions across Canada. Let me think. I think the only ones we offer is periodontology and orthodontics. Are two specialty programs. So those are clinical programs that allow you to expand your area of practice. We do have other masters and programs like that, but some of them are just research based. They're not clinical. So those are the two programs, and we offer those at the MSc level and the PhD level.
And then how do you prepare for the DAT? Is there a minimum score?
Yes. So the minimum score for the DAT is there's three different sections. They're out of 30, and you have to have at least a 15 in each. That's the minimum. Competitive is higher. In terms of preparing, I wouldn't be able to say what's the best way. I believe on the DAT website, they have a little bit more information there about what types of questions they're asking and whatnot. Um, but a lot of it, like the Survey of Natural Sciences, is your biology and your chemistry knowledge. Um, and then perceptual ability is definitely one that you'll want to find some practice questions for, because I've seen what the perceptual ability is and it blows my mind. It's all about shapes and being like, if this shape turned, what would it look like? And you have to pick from it, or it orientates this way. And that's all about um, you're working in a mouth with a mirror. You need to know what it looks like at all angles and be able to see that in your mind. And then reading comprehension is your basic kind of more or less reading. But you can find a lot of information, I'm sure, on the DAT website.
Um, okay. Would it reflect negatively on an applicant if they haven't done much verifiable volunteer work? And then we had another one that was saying, are there a minimum number of hours of volunteer work that's required?
We don't state a minimum. More is obviously better. I guess what I would say is that, 20 hours is not a lot, especially over a span. So it's more than that. Um, so, do what you can on that. If you don't have a lot of those activities, those sections will do poorer. But, the personal experiences isn't the only section. Obviously, I encourage people to do as much as they can. However, that's not the only sections that we look at. We're looking at your Casper and your DAT as well. So, people who are stronger in different areas can be weaker in others.
This is a good one on Alberta residency. So, is there a minimum time period for which a candidate has to live in Alberta to be considered an Alberta resident? And then they gave an example. For instance, if one moved to Alberta in 2024 and they're applying for fall 2026 admissions, would that person be considered as an Alberta resident?
So Alberta residency is defined as living in Alberta 1 year prior to the term that you're seeking admission for. So if you were wanting to get admission to fall 2026, you would need to be living in Alberta since September 1st of 2025. So if you've been living here before then, great, and you're going to continue to live here, also great. But if you're thinking of moving or something like that, you would want to be living here before or around September 1st and then live continuously here up until the beginning of classes, which are usually end of August. But um, yeah, we do spot checks on those kinds of things. So we may ask for additional proof, but nothing needs to be provided at the time of application.
Um, are fourth year students or older students favored over those who have only completed 2 years of undergrad?
Another great question. So similarly, they just get your GPA at the end. They don't know how many years of study you've done. They just know you've done at least 2 years of the 30 units. So there's no preference in that way. The only thing I think that happens often where older students are being admitted maybe more often into our program is they've just had more time to do stuff. They're more mature, things like that. They're just doing better in our process, but there's not an inherent, oh, this person's graduated, extra bonus points for you.
Um, what is a typical prompt for the personal response, and are there training sessions available for those kinds of things?
I wouldn't be able to share what kinds of things we're looking for in the personal statement. They're usually fairly short questions that are relevant to the profession or things we're looking for. So that's kind of as much as I can say on that. In terms of any preparation, I don't have any recommendations because I wouldn't be able to say whether, I don't know what people are doing for prep. Like, I took this program or I did this thing. And then I can't say whether it worked. So unfortunately, I don't have much advice there. Um, Up to you to figure out what the best way for you to prepare for that is.
And then for the employment section, is it a must-have, or is it enough if you have a lot of volunteering hours?
So if you do not put anything in a particular section, you will receive a 0 for that section. So it will obviously be negatively impacting. Your score will be lower than obviously if you otherwise would have had something there. So again, I kind of had said, for people who might have lower, that there are other ways to potentially have a strong application with other areas, but it is a risk that if you don't have anything that you will score lower.
Would a Bachelor of Science in Biology be a good start before applying to either program?
Yeah, definitely. That program typically allows for you to take the courses required. Again, we don't look at what program you're in. So if you're in neuroscience versus just general biology, there's no advantage. It's just about picking something that you would want to continue doing. We have a lot of applicants to our program and not everyone is able to get in. So we always recommend choosing something that is going to be passionate for you so that you can continue on with that rather than picking something that you think is going to get you into dentistry and it doesn't and you really, really hate it.
I said it to everybody, choose something as your undergrad that you truly, truly love, because if you're not successful in your application to the professional program of choice, then you can just continue on doing something that you love. Um, okay, so once they do their application, is there a platform that they would get any progress on, or updates to once they've submitted that?
So when you submit an application, you can then access it through the U Alberta Launchpad. So that has a lot of information on there. So if you're like not a U of A student, it'll tell you what your student ID is, which is relevant if you're calling us or emailing us and asking us what's going on with something. We know who you are. Um, it also includes a checklist of all the things that we need from you, so you know when we get stuff. If you are in an Alberta institution, we often can get all of your transcripts for you, so then you're not having to pay for that. But you're also able to upload stuff there as well. Um, so then if for any reason, you don't want to wait for us to get around to getting it for you, you can just upload it right there and we can see it. And that's also where the personal experiences forms will be. Unfortunately, the system doesn't quite do a lot of updating. So more or less, you're going to hear nothing, or you'll hear something, and the something is usually bad news, because that's how we send our decision letters. So if it's early on in the process and you receive a decision letter, we will tell you exactly what the reason was, on all reasons, not just, oh, well, this was the first thing we saw, so that's why you've been denied. We would say we have thoroughly evaluated everything. These are all the things that are missing. And we also do provide people with the opportunity to fix some of those things. Like if you just thought, oh, this math course I'm taking is totally statistics, and we're like, no, it's not statistics. You're like, okay, I can register in a statistics course in the winter term. That will work. And then we can still consider your application because we understand it's a year long and it's a long time to wait. So we do our best to notify people as early as they can so they can fix some of those issues. But otherwise, if you don't hear anything, usually that's better news that everything looks great, and fine. Basically, the next time you'll hear something from us, that's very, kind of confirms good news would be if you're invited to the interview.
Um, okay. If somebody completed their schooling from a different province and then they've been living in Alberta for 1 to 2 years, would they still be considered an Alberta resident or a non-Alberta resident?
So it doesn't matter where you completed your education, it matters where you're currently living. So, like I'd said, you have to be living in Alberta at least 1 year in advance of the year that you're seeking admission for. So, fall 2026 admission would mean that you need to be living here since September of 2025. So, if you're currently living here and plan to keep living here, then great, you're an Alberta resident.
Perfect. And then for GPA, is it averaged from all years of the undergrad the student has completed? And are the years weighted evenly?
So, overall GPA looks at all years of full-time study. Let me just actually pull that page up here. But this one's for dental hygiene, but it applies more or less how we do the calculations. So it's all full-time coursework. So if you did 18 units in fall winters, 12 units in spring summers, any of those are going to be included. Like I said, if you did like one spring summer course, that's not going to be included. So make sure when you're doing your GPA calculation to figure out, where you're sitting at, that you're excluding, those periods that don't have the full-time study and keeping everything that does. So we always bunch the fall winters together and spring summers together. Um, and then let me just remember. Oh, how are they weighted? So it's a weighted based on the units. So it's not like every year is treated equally. If you did 18 units in one fall winter, but 24 in another, 30 here, um, it's going to be based on the units. So obviously 30 units, whatever you get there, is going to weigh more than other years, but it's the same way you would calculate your, like that. It's the same way you'd normally calculate your overall like your GPA within your program. Is that a 3 unit course is the same as another 3 unit course. If you take a 6 unit course like physiology and you get, a C in it, well, that's basically like 2 Cs in a 3 unit course, right? So there's no particular year that's weighted more. They're just, are they included or are they not? And then just about, what the GPA was versus how many units was done.
And then a more specific question, do kinesiology, sociology courses count as the sociology requirement for dental hygiene? Do you know offhand?
That's a good question. I'd have to see what the course code is. I don't quite remember. If you want to email that to me, at the admissions, .dentistry at ualberta.ca, I can take a look at that for you. They may.
Um, this is a good question, actually. Would you take a look at unofficial transcripts beforehand to have a glance and see if they've met requirements for the required completed courses based on what they have on there?
Unfortunately, we can't do any unofficial evaluations. We receive quite a lot of applications. I only showed you the qualified ones. This year, I think, we have almost 900 applications between the two programs. If all of those people had asked for unofficial evaluations, plus the ones that didn't even apply, unfortunately, I would never get to the people who applied. So, yeah, so unfortunately, we're not able to do any unofficial transcript evaluations. But we do try to really lay it out on the website. If you have any confusions about what the requirements are, how to look at them, I can definitely walk through those things, but I wouldn't be able to take a transcript in my hand and look at it for you. We have a lot of the resources online to check like course transfers if you're coming from another institution and whatnot to give you those ideas. So definitely take a look at those if you're trying to figure that out.
Yeah, there's lots of resources. The websites, if you guys have not looked at them, are very well laid out. Like they are some of my favorite for professional programs because they have everything on there that you would ever need. For external to Alberta institutions, we have our transfer credit search tool. That's a really great tool to use because dentistry and dental hygiene require transferable courses to meet their requirements. So it makes it a little bit easier for you to do your own evaluation on that. And then, like Rosanna said, with that sociology course, typically if there's like one course that they're like, you're like, oh, it's like on the verge, I don't know if it's actually an account, then maybe you'd be able to send them one that you don't know, but not a full transcript. So,
Hmm. Yeah, there's definitely things when it comes to coursework. Sometimes it's easy to just say yes or no. Like some people will ask about an English course. I'll take a quick peek at it and be like, as long as it transfers as English, we're all good. But if it says but there's some things I know are red flags. So if it said, oh, this is writing essays, I'd be like, ooh, that course might transfer as writing, and that is a different department than our English department, and it might not work. I wouldn't be able to necessarily give a guarantee on that because we usually have the registrar's office review those more thoroughly, but my instinct would say it's probably not going to work. Up to you. You can either do it, hope for the best, or maybe steer into a different direction.
yeah. Any other questions that we can get to? Obviously, things of a more personal nature, like coursework and specific situations, definitely email the admissions email for dentistry. They're going to be better able to assist with very specific personal situations compared to more of a group setting like this. They'll be able to help you more with those. Definitely check out the websites before you email them, though, because, like I said, they are all inclusive. They are great websites for all of the requirements and admissions and where to submit your application and the timelines. They have a checklist. The checklist is the best thing ever. So definitely use that.
Yeah.
Um,
Also, I'll just add quickly that the numbers I shared today, like what the overall GPA was for those admitted, how many applied, all that stuff, it's on our website. I just share it here because obviously I'm talking about it, but it's available. This isn't a secret that I keep to myself on how many people apply every year. We update those every September. Once our class is admitted and it's been solidified. But you can always find that there to kind of know what the latest is.
okay, another one on the Alberta residency, a little bit more clarification here. So if they are applying for dental hygiene at the beginning of their undergraduate year, should they apply as an Alberta resident with the foresight that by the beginning of the program they will have lived in Alberta for a year?
So obviously, like, yeah, if you're applying for fall 2026, you would have not actually been living here for a year quite yet, but we would maybe follow up and say we want proof of a lease or things like that. I'd recommend if you are in that space where you're like, yeah, I'm moving in like August, I'm going to be here beginning of September and have moved. I'd recommend maybe waiting till you actually move because when you fill out your application, it does ask you, are you an Alberta resident or not? And it's a little weird to be like, yes, I am, but I actually only just moved in September. And there's still lots of time. Like applying, I will say applying early doesn't really give you much benefits. We don't really start working on stuff until September anyway. So if you want to get it done and over with in July for most people, that's great. But if you're kind of in that space where things might change for you or you're not sure about your registration or things like that, definitely fine to wait till September. I just don't recommend waiting till end of October.
Can you take the Casper test multiple times or only once?
Only once per year, they do not let you do a retake.
Uh, Well, this is a good one. For someone who has already completed a program and have a bachelor's degree, they're looking to go into dental hygiene. Would they have to enter into a Bachelor of Science program, or could they take the required courses without being in a program?
So the Bachelor of Science, the only thing that'll be like the most major hurdle will be that 27 units in one fall winter. If you didn't do that at all in your original bachelor's degree, the only way is to go into another one. But if you did that, that's great. That's like the hardest one to meet if you didn't plan for it in advance. Otherwise, you can take all the other required courses. However the heck you want. We're not picky about those. They don't have to be done in that 27 credit year. We leave that really open because of people in this exact situation. Some people don't make the plan and know immediately out of high school that this is what they want to do. They go do other things and realize this is a career that could really be for them. And so we try to, as best as we can, allow for people later in their degrees to be able to meet our requirements. So you can take all those required courses through open studies for sure. It might just take longer depending on what you didn't cover. So that's really up to you.
Okay, we have about 7 more minutes left in our time. Any other questions that we haven't answered? There have been some great questions today, so.
Hmm.
Mm,
You might have to elaborate what you mean by transfer
yeah,
credit for more than one course.
exactly.
I'm not quite sure if you're talking about repeating a course, which I will actually bring up now that I've thought about it, just to share. But I might just need a clarification on what you mean by that. I'll let you write that out. But what I'll add is that it's a common question I get is what do I do? How do repeated courses get looked at? So there's two basically different scenarios. If you take a course and you pass it, so a pass would be at least a D here, C minus everywhere else, basically the same thing as whether or not a required course is met. If you get at least a grade in that and you're just like, oh, that's such a crummy grade, I want to get a better grade and I want it to be replaced. In that case, um, if you passed it, we won't take the second attempt for credit or for grade. So you can't take a course again hoping to get a better grade. If you failed the course, or if you're from another institution and you're transferring here and you got it, less than a C minus, then in that case, you are allowed to repeat it for credit. However, we will look at potentially both attempts in your GPA. It depends whether they're in full-time study or not. So if you took a class in the spring by itself and you got an F, lucky for you, it's not going to be in your GPA, but you do it the second time in full time, then it'll be included. But if you did both of them in full time study, then we're going to take both. I wouldn't be, I see the one about the
Yeah.
the no C minus grade. I wouldn't be able to say without seeing a grading scale or knowing what institution it's from, um, where a D would sit. It might honestly just skip. But if you want to send us an email and tell me what institution you're from and what would be equivalent to a C minus at your institution, I can let you know that.
Any other questions? Also, for the transfer course question, there was no further elaboration on that. Did that answer what you were asking? Um, for the more than one course situation.
The only thing I can think of is that typically, I'm just confusing my, because normally if you're transferring courses and something transfers as the same course, you wouldn't get credit for both,
Yeah,
but that's probably not the situation you're in because that's a little bit rare to take because usually be an anti-requisite at your own institution. So
yeah.
yeah, it's just a matter of it it just transfers 27 units. So um,
Mm,
I will pull it up.
perfect. Thank you.
Ta-da! Here we go. This is how you reach me and my colleague. Happy to answer all the questions.
Last few minutes, any last questions? Otherwise, please reach out if you have other questions that you need answered, that you wish you would have asked today, anything like that. I think we'll call her done. Thank you, everybody, for attending tonight. It was a great session. Thank you so much to Rosanna for presenting all of this great information and answering all of the questions at the end here. Again, if you have more questions, please email us, let us know, or attend future events that will be hosted. If this isn't quite your year to apply, there will be more of these in the future where you can get more of this information and check out those web pages because they are the best, like I've said multiple times. So thank you everybody for attending and have a great evening.
Thank you.
Bye.